I want to talk to you about the two elements in childbirth. This was a primary understanding that Birthing Better Families discovered. We sort of know it, but we need to define it really, really clearly. If we don't define it, then it becomes confused. And that is the words used in childbirth called suffering and risks. These are confused. So let me explain what we began to understand in the 70s, because as you've learned and will learn as you go through the course, when I gave birth in 1970, there was only a 4.5% cesarean rate, which meant 95% of us labored, gave birth vaginally. Among all the assessments, monitoring, and procedures, and whether we had risks or not, because there was nothing really that the medical profession could do except to stop the suffering. And that was done in my mother's generation by just knocking women out or giving them such heavy pain relief that they didn't remember the birth at all. So suffering has never been connected with there being a problem. And that's important to know. Suffering is a direct relationship to whether or not a woman has any skills to work through the activity of birthing her baby. So that's one element, is suffering. You don't want to suffer. That's the biggest issue in childbirth. The biggest, always has been, always will be. Because even when there are risks, even when those risks become a problem, very few problems actually have a death or serious injury. They just are a risk, they just are a problem, and they resolve with a healthy mother and a healthy baby. So suffering is the bigger issue, and that has never been, ever been addressed in the natural childbirth movement. Never been addressed. What's always been addressed in the natural childbirth movement is to focus on low-risk pregnancy and birth, and to assume that women who are low risk can then birth with no medical care, that they'll find it easy, that they'll have a good outcome, there will never be a problem. And that's not even accurate. Many low-risk pregnant women have issues in birth, and one of the issues they have is they suffer if they lack skills. They can have a delay in first and second stage. They can have problems with their baby that are undiagnosed or that happen, like a cord that's a problem, or a very tight crotch and a baby's delayed and then has a problem breathing. So let's deal with suffering. A lot of the Birthing Better skills are skills for you to cope, manage, work through, handle, deal with, stay on top of, and feel in control. In other words, no matter what is happening to or around you, no matter your beliefs or your choices or your lack of choices or your change of choices or who the care provider is or anything about birth, you have to do the activity. And when you have skills, you will suffer less, because you will do the activity more skillfully in order to cope with the pain or the discomforts or what they do to or around you. So that's one element. It's an important element. You have to deal with this element. You don't want to suffer. And when you suffer in childbirth and they, the medical profession, are trying to save you, they are doing things to you which you may not want or like. And so if they see you suffering, they will try to save you or help you, doing what they know best within their field. So if you don't want them to impose those things on you, then you need to behave. You need to sound and look as though you are coping and managing and staying in control. And this is a very important issue, because the medical profession doesn't care if you're suffering. They just want to save you, so they'll give you pain relief. The natural birth movement believes that if you suffer in childbirth, that's just a natural part of birth. that if you're screaming or making lots of noise or look distressed, then you just know what you're doing. And that's just normal, and no one should be telling you to birth otherwise, because it's your birth. And you know what you want, and you know what you're doing, because birth is instinctive to us as women. So that gives us a very confused message. Birthing Better wants to give you a clear message. We don't want to suffer in childbirth. So therefore, we should become skilled so that we can do the activity of birthing our baby using skills that prevent us from suffering. And then they will see us as coping and managing, and our behaviors, our sounds, how we look will be in alignment with the fact that we're managing, even though we don't like it or do like it or hate it or love it or whatever they do to us. So that's one element. So that has nothing to do with risks. Risks can overlap, but suffering has nothing to do with risks. It's what scares men, because they see women in pain, they see women out of control, they attribute pain to being a problem. And the medical profession goes, no, this is normal. But for men, they can't understand that unless they are skilled, unless they understand that it just hurts like a mother, and their job is to help you cope and manage. So we don't want to equate suffering to a risk. And there are many women that have very high risks, numbers of risk factors, who when they labor and have vaginal birth, they cope fine. The birth is easy. They don't suffer. They do well. And the baby comes out, and either there's a problem or there's not a problem with either themselves or their baby. So risks and suffering are not connected. Risks are not connected to where you birth or who is present. Risks are connected and get exacerbated when a baby has difficulty getting out of your body. So if you have risks, your first line of defense for any risk is to prepare your body to help your baby get out of it more efficiently, with less effort, and in a shorter period of time. We have that power. We have that ability in our women's bodies to open up for our baby if we learn how. If we don't learn how, then we don't know how. It isn't automatic. Women don't automatically know how to create space in their pelvis. In fact, many of the positions that are being advocated close off the space or are actually lying on your belly like hands and knees. That's not an upright position. Your thighs are upright, and that's the only part of your body that is. Your baby's actually falling forward and onto the ground. And it's almost the opposite of lying on your back and feet in stirrups. Abducted squats with your legs out to here close off the muscles that need to be relaxed so that your sacrum can move, so your baby can move your sacrum in order to come down and turn the corner to come under the pubic bone. So when we started Birthing Better, many of us had multiple risks, and we learned skills so that we would birth better. We opened up our body. We reduced internal tension. We created space. We created mobility and softness, and we learned how to do it. And we learned how to do it by behaving as though we were coping, no matter what our mind was saying. We can't control what our mind thinks about the experience. We can control our responses to the experience. So these are the two very important elements. If you have risks, then prepare your body at a more deeper level. If you think you're low risk, prepare your body at a more deeper level. You don't want to end up with a delay in first and second stage or an unplanned cesarean because you didn't cope. In other words, we should have it be absolutely natural and normal that during pregnancy, we learn the skills to create space in our body, learn to open up our bony structure, learn to soften our soft tissue, learn to prepare our birth canal, and learn the skills so that we cope and manage with the natural occurring pain or all the fiddle that they do to us. And if we're having a non-laboring cesarean, we do those things because this is our baby's birth, and we get pregnant so infrequently, and we need to be more engaged in the process rather than having a non-laboring cesarean just become like a dentist appointment. It's not. You want to stay engaged. And if you want to prevent those unplanned, unnecessary, or emergency cesareans, then it's your responsibility to understand these two elements and to learn your birthing better skills to address both of them.